ABC 40.
We start with new developments this Friday after Mercy Medical Center said they're making the difficult decision to temporarily suspend their maternity and newborn services. Welcome everyone to Western Mass News at 4 o'clock. I'm Amanda Martin Ryan. Western Mass News reporter Madison Lazowski joins us live in studio after hearing from those seeking and providing maternity care. Madison.
Yeah, Amanda, this situation not only creates a problem for those mothers and families whose care was centered around Mercy's Family Life Center, but now the few birthing centers that are left here in the area are worried they'll see an influx of patients in an already difficult position. Mercy's statement says in part that due to significant provider and nurse staffing constraints that have persisted over several months despite concerted efforts to recruit and retain clinical colleagues, the last day their maternity and newborn services at the center will be open is now just a month away on December 8th. They say that the certified nurse midwives will continue to provide pre- and postnatal care at Mercy's outpatient sites throughout the region, and they will continue to support patients and provide hospital-based care at Bay State Medical Center through a cooperative agreement. In the meantime, the hospital is working with impacted employees about available positions and other potential options during this time. The closure is now putting a bigger burden on the handful of birthing centers and services here in Western Mass, especially following the closure of Holyoke Medical Center's birthing center back in 2020. Robin Sauvé, the executive director of the Bay State OBGYN group, explains that regardless of centers being open, babies will be born when they're ready to come out.
Big challenge is call. We have to have somebody present 365 days a year, 24/7.
At Bay State OBGYN group, there are around 24,000 active patients at a time, with only 8 providers who are able to deliver babies. And now that number is expected to rise. These hospitals and centers aren't the only ones that are concerned. Comments on our Facebook post about this closure read, so there's only 2 area hospitals where babies are delivered, and we're just going to shut down one of them. What kind of overload is that going to have on Bay State now, trying to find rooms to deliver twice the amount of kids? That puts mothers and babies in danger if there aren't adequate facilities or rooms. Now, to find a birthing center or hospital close and convenient for you amid this closure, you can head to our website at westernmassnews.com. For now, reporting live in studio, Madison Lazowski, Western Mass News.